It's a Northwest News Radio weekend. IRG's Health Talk continues.
All right, guest number 2 today is Dr. Ryan Vellinga, an orthopedic surgeon at Skagit Regional Health, who specializes in sports medicine, arthroscopy, and reconstructive surgery. Rotator cuff, Shannon, we've heard about rotator cuff tears for a long time now, but there's new technology that he's going to be telling us about.
Yeah, there's always new technology, and Dr. Vellinga is going to talk about a new technology to do surgery and repair what's called an irreparable rotator cuff, a rotator cuff that has so much damage that you used to not be able to repair it, but there's new technology out there that, again, Doctor is going to talk about. Normally, in these situations, they used to have to do what they call a reverse total shoulder, but now they can do this new technique. So let's hear about that.
All right, let's do it. Here is Dr. Ryan Vellinga and Shannon O'Kelly.
Dr. Vellinga, welcome back to Health Talk. How are you?
Doing wonderful. Thanks so much for having me on again.
What we're going to talk about today is this rotator cuff situation when you may tear your rotator cuff and then maybe it's difficult to repair. And I know you being an orthopedic surgeon, this is kind of an area you practice. Tell our listeners about your practice, kind of your interest, maybe your training, and then we can dive into this rotator cuff, okay?
Absolutely. So I am an orthopedic surgeon. I did a fellowship, meaning an extra year of training in sports medicine, minimally invasive arthroscopic surgery, and also shoulder reconstructive surgery. So my fellowship highly emphasized complex shoulder surgery, and my practice has kind of mirrored that. I don't really do any knee and hip replacements, but I do a lot of shoulder replacements and a lot of shoulder surgery for all ages and pathology types. And then the rest of the practice is other sports medicine procedures with the hip and knee and ankle and other upper extremity. So I love shoulders, my favorite body part to think about and work on and help people with. And I love thinking about complex shoulder problems and finding solutions to them.
Let's talk about the shoulder because, like you, I love the shoulder. I think it is a fascinating joint. It's the mechanics and what it has from a mobility standpoint and just how it's put together. And here you have this large ball in a small socket. So let's talk about the shoulder joint from the mechanics and then this rotator cuff mechanism and just all the structure of the shoulder. Let's get into anatomy and physiology. How's that?
Absolutely. I love it. Well, it's a great first description. It is a large ball on a small socket, like a golf ball on a tee. And so since it's a shallow, small socket, that ball it not only rotates on the socket, but it also can translate up, down, front to back a little bit. So there needs to be a series of ligaments that help keeping that ball from dislocating off the socket. And then you need a number of different muscles and various orientations that can help rotate the arm around in space without that ball and socket moving in a way that causes pain or weakness. So your ligaments are the connective tissue that connect bone to prevent it from dislocating. And then outside of that, you have your rotator cuff, which is a term that we use to describe a group of muscles that attach from the front, the top, and the back side of the arm bone up in the shoulder joint to help rotate the arm around in space. Part of the job of that rotator cuff is to keep the ball centered on the socket throughout the movement so that your larger shoulder muscles, like your deltoid muscle that they give you shots in, can do the real powerful movements of your shoulder. So the rotator cuff is great when it's working great, and when it starts not working great or there's a problem in one of those tendons where you get a tear in one of those tendons, that's what we call a rotator cuff tear, and it can be any of one of 4 tendons typically. And once you have that, there starts to be a lot of dysfunction in that ball socket movement that can really lead to significant pain and weakness and can really become a nuisance.
Excellent description. I mean, great job. Anatomy, physiology, shoulder mechanics 101. Fantastic job. The tear, though, as a surgeon, sometimes you have to assess this tear in the quantity or the type of tear. Maybe talk about the typical tears you might see, if we can do that in 30 seconds, and then we'll come back and talk about intervention.
So tears can occur in the rotator cuff either traumatically from a fall or some type of injury, or slowly over time in the form of a degenerative tear. And these tendons have a broad insertion. And so you can have a partial thickness tear where just a portion of that tendon is starting to tear, but most of it is still intact on the bone. Typically, those partial tears are when we can treat this conservatively. But if the tendon goes on to have a portion of it that is completely detached from the bone, that's when we're worried that it's now become a major structural problem in the shoulder. And unfortunately, no amount of conservative treatment in the forms of injection injections or therapy is going to make that tendon reattach itself into the bone. So kind of size and amount of tearing, and if there's retraction away from the bone, will dictate what our treatment recommendations are.
More with Dr. Ryan Vellinga and Shannon O'Kelly coming up next right here on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
Our conversation with Dr. Ryan Vellinga at Skagit Regional Health about rotator cuff tears with Shannon O'Kelly now continues.
Dr. Vellinga, man, we're talking about shoulder repairs. Now, generally speaking, you can usually go in and repair those tears that need repaired, and the outcomes are pretty good. But I want to really talk about those people that maybe that rotator cuff is irreparable. But tell us about the repair of a common tear, and then tell us about maybe something that's not repairable.
Right. So for those tears that need a structural repair, typically we can go in either arthroscopically through small incisions using a camera in the shoulder and find the tear and reattach it to the bone. And if you get a good repair where there's not much tension on it, you got good tendon quality, then we expect great outcomes for your shoulder. And that's always the best case scenario. But sometimes we can't do that. Sometimes someone has a repair years ago and it re-tears or maybe never completely healed and goes on to more tearing, or they don't have it fixed. And after time, the tear becomes bigger. And now we've got a situation where we've got this rotator cuff problem that's very difficult to fix. And so that has been a real challenge for us. And in the past, we've come up with treatments like something that's called a superior capsular reconstruction, where you're taking a piece of someone's skin as a graft to anchor it into the ball in the socket to try to hold the arm bone centered on the socket. And it's typically a 6 to 12 month recovery with that. It's a lot of hardware. You got to get that graft to heal. And the outcomes at first were very promising with that, but the more studies we've done, it's maybe not as promising as we first hoped. So the other treatment has also been to do a reverse shoulder replacement, where we replace the ball in the socket and we put the ball on the socket side and the cup on the arm bone side. And by doing that, the design of those implants, the way they contour against each other, stabilize the ball and socket joint and allow your deltoid, your big muscle, your deltoid, to do all the work without your rotator cuff. But for someone who doesn't really have much arthritis, to cut the ends of the bone off is a real tragedy just for a rotator cuff problem. So there's always been interest in, is there something else we could do? And this new treatment that's newly FDA approved in our country called a subacromial balloon spacer. And it's basically a device that's going to do what the superior capsular reconstruction tried to do and what the rotator cuff's job is to do, which is hold the arm bone down so it's centered on the socket, so that as you try to raise your arm up, the arm bone doesn't ride up and hit on the undersurface of your shoulder blade bone called your acromion and impinge right there. That's what limits people's motion and causes pain. So if we can do something to hold that down so that the deltoid can get past that critical angle to get the arm all the way up, is, a challenge. So this balloon spacer it's a dissolvable material that goes in, it holds the arm bone down. First year of having that in there, your rest of your shoulder muscles learn to accommodate for not having your rotator cuff. And people see a reduction in pain and improvement in motion, but it doesn't carry the same long recovery that a superior capsular reconstruction does. And it's not an irreversible surgery like the shoulder replacement. It's a much accelerated physical therapy recovery. And it doesn't burn any treatment bridges if it didn't work. But what we're seeing is in that the studies, people had significant reduction in pain and improvement in motion. And those results were maintained at the 1 year, 2 year, and even up to the 5 year time point.
That's been Dr. Ryan Vellinga, orthopedic surgeon at Skagit Regional Health, specializing in sports medicine, arthroscopy, and reconstructive surgery. And Shannon, a long time ago, I had rotator cuff surgery, and I wish I had heard about this technology back then.
Yeah, Tom, that's just medicine right now. The advancements and what they're doing in new procedures and protocols, and again, minimally invasive surgery. But this technology of treating irreparable rotator cuffs can be very beneficial for someone. Good news is your cuff was repairable, but sometimes people get irreparable rotator cuffs. And again, their only option in the past was a total reverse shoulder. Now they can do this new balloon technique.
That's amazing. SkagitRegionalHealth.org for more info. Our next guest after this time out on Northwest News Radio.